distinguished colleagues. So my name is Gianfranco Spiteri. I lead the group working on epidemic intelligence at the CDC, and it's great to be here. And I want to thank particularly Mercy, Wari, and the rest of the EBS team at Africa CDC for inviting us, and also for working for having us work with them in kind of developing a partnership, which has helped also with this EBS framework. And of course, EBS is a core activity for both organizations. As Dr. Yen, you said, it saves us money investing in early detection, but it also saves lives, and I think that's a very important kind of focus that we should keep in mind in developing our EBS activities. The framework which is being presented these 2 days will make a big difference on the ground with member states. And I think it will also be a reference document internationally. We have also, as Dr. Yen mentioned, there is an aspect of evaluation which is also very interesting for us at ECDC, as we are thinking about similar scope for our work around preparedness and around threat detection. ECDC has collaborated around the EBS framework as part of a strengthened partnership with Africa CDC in the last couple of years. And this partnership has been especially close in the area of epidemic intelligence and event surveillance. And that's not very surprising, because we have very similar mandates, very similar structures in terms of being linked to supranational political unions. And also we have had very similar recent experiences in terms of changes following what has happened with the COVID pandemic. So ECDC has had a new mandate. The Africa CDC has also had a strengthened role in public health in Africa. We're also both undergoing a period of change, and this has meant this has resulted in a new mandate which the European Commission has and the European Parliament has approved at the end of last year. And with this new mandate, we are also empowered now to work more closely at an international level. And the project which we have with Africa CDC, which focuses on a number of different areas, will help us build this work and collaborate in an even stronger way. This project, which I mentioned, focuses on 3 main areas. One of them is around preparedness and early warning and threat detection. We're also working around training and capacity building, and also focusing more on collaboration in the different public health fields. In the last couple of years, we have worked very closely with Mercy's team on a number of issues. And not only, I think the relationship has not been one where we have received a lot of valuable support from Africa CDC. For example, last year with the Mpox outbreak, when it started, Mercy and colleagues were key for us to identify colleagues in Nigeria, for example, Nigeria CDC, to describe their response to the Mpox outbreaks which had previously happened. We're also collaborating now in threat detection in different ways. For example, with the current Marburg outbreaks, Marburg virus disease outbreaks, we're monitoring jointly the events through the Epidemic Intelligence from Open Sources tool, which WHO has developed. And we're also working together around mass monitorings. For example, with the FIFA World Cup, we were sharing signals and collaborating around that as well. So there's benefit to both sides in this approach. One other area which we're working on is also around training and sharing of experiences. And here I'm very interested in kind of what we will hear later about the community of practice which is being developed, and that could be useful for sharing experiences within the continent but also with European countries. We're thinking about developing something similar at European level in terms of networking more closely with countries in the coming months. And colleagues from Africa CDC will also join this meeting, and we hope that this will be kind of a way of strengthening collaborations across the continents. So I won't take more of your time. I think it's an excellent opportunity being here for us. And we look forward to continuing to support and work together with Africa CDC on threat detection activity and on further implementation of the EBS framework, which will be presented. Thank you.
Thank you very much, and fantastic to hear what the ECDC is doing here across the continent. I'd like to hear now from the East, Central and Southern Africa Health Community Director General, Professor Dambisya, and that is a role that he has held from 2014. Let's give him a round of applause as he makes his way up. Director General, Professor Dambisya, and that is a role that he has held from 2014. Let's give him a round of applause.
Thank you. Thank you very much to our hosts. The Minister of Health of the Republic of Kenya, our conveners, the Africa CDC, delegations from member states, fellow participants from various collaborating agencies. Good morning and welcome to this very exciting event. May I begin by congratulating the Africa CDC for bringing us all together to witness, but also to help deconstruct what the EBS resources are all about. And secondly, to emphasize the cardinal role of the early warning systems and mechanisms that are at the heart of what these are about. I should like to inform the August House that in February, when our health ministers under the East Central Southern Africa Health Community met in Maseru, Lesotho, one of the recurrent messages was that it was not a question of if, but when the next outbreak would happen. Lo and behold, the region is facing a massive cholera outbreak in Malawi. As if that was not bad enough, the climatic contribution from the typhoon came about, and right now we are also sitting with the outbreak of Marburg in Tanzania. And all these help emphasize the old wisdom about prevention being better than cure, but also the wisdom